Galsulfase, also known as Naglazyme, is used to treat a rare genetic problem called Maroteaux-Lamy syndrome, MLS. It works by replacing a certain natural substance that is missing in people with MLS. This medication helps improve mobility, such as how far you can walk and the number of stairs you can climb. It's important to note that Galsulfase does not correct the genetic problem, and treatment must be continued for life. When using Naglazyme Vial, it is important to follow your doctor's instructions. The medication is administered slowly into a vein, typically over a 4-hour period once a week. The dosage is determined based on your weight, medical condition, and how you respond to the treatment. If you are using this medication at home, it will be delivered to your home and a nurse will come to give you the treatment and monitor you afterward. It's important not to shake the medication and to visually check for any particles or discoloration before using it. If you notice any, do not use the medication. Any unused medication should be discarded and not saved for later use. It's important to store and discard medical supplies safely. Naglazyme Vial may cause side effects such as fever, chills, rash, shortness of breath, nausea/vomiting, increased blood pressure, headache, chest pain, dizziness, weakness/tiredness, joint pain, flushing, and coughing. Your doctor may decide to stop or slow down the medication infusion if these symptoms occur. It's important to tell your healthcare professional right away if you experience any of these symptoms. Your doctor may also prescribe other medications to treat any reaction and to prevent them from happening again before your next treatment. Using Naglazyme Vial regularly will help you get the most benefit from it. Try to use it on the same day each week to help you remember. If your condition worsens, be sure to inform your doctor. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Before starting Naglazyme Vial, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that can cause allergic reactions. Also, let your doctor or pharmacist know about your medical history, especially if you have heart or lung problems. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications and products you are using. If you are pregnant, use this medication only if clearly needed and discuss the risks and benefits with your doctor. It is unclear whether this medication passes into breast milk, so consult your doctor before breastfeeding. When taking Naglazyme Vial, it's important to be aware of potential drug interactions that could impact its effectiveness or increase the risk of side effects. It's important to keep a list of all the medications and products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. You should always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone takes too much Naglazyme Vial and has severe symptoms like fainting or difficulty breathing, they should call 911. Otherwise, they should call a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. This medication should not be shared with anyone else. Be sure to take Naglazyme Vial as directed by your doctor. If you happen to miss a dose, speak to your doctor or pharmacist to get a new dosing schedule. Do not take a double dose to make up for the missed one. After you receive the Naglazyme Vial, you should store it in the refrigerator and keep it away from light and freezing. Once you mix it, make sure to follow the product instructions for storage and ask your pharmacist for more details. If you have any unused portion, make sure to discard it properly. Also, keep all medications away from children and pets. When the product expires or you no longer need it, consult your pharmacist or local waste disposal company for proper disposal. Do not flush the medication down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.